therapist here at T0 Physio, and I specialize in the pelvic floor, pelvic health component with PT. And really my main goal for today, it'll be a lot of talking, but just to educate around your pelvic floor muscles and dysfunction that can sometimes happen, symptoms that you can have if you have something going on with your pelvic floor, and then teach you really just kind of one main strategy that I think most people can benefit from if you do have symptoms related to your pelvic floor. So the biggest thing really is, the biggest thing I find is that most folks don't even know that they have a pelvic floor muscle group or what those muscles even can do for you. And really too, I would say the biggest traction that this specialty has had recently is in the pregnancy and postpartum world. But know that everybody has a pelvic floor. You don't need to be pregnant or have given birth to have symptoms. You can be a younger, older person, male, female, anyone can have something going on, and something, we can do something to help you get better. So too often really I hear statements around like, oh, I just leak a little when I run, or no, I don't do those jumping exercises in class, or it only hurts sometimes. But really there's something you can do if any of that kind of resonates with you for something that you have going on. And so the pelvic floor muscles help with all things bladder, bowel, and sexual function. And so that can be then related to having symptoms with urinary or fecal incontinence, pain with intercourse, constipation, anything like that can be going on. But for the purposes of today, I'm going to focus mainly just on the bladder health component, because other than that, it can be a very wide, diverse thing. But if any of those symptoms kind of resonate with you, know that there is something you can do. It can be common to have these symptoms, but it's not something you have to live with. So scheduling an appointment would be good. So next I want to dive into a little anatomy. So these muscles are located internally. So we can't see them, we can't feel them. It's just a lot harder to know what's going on through here. So I think visualizing this part of our body can be a little helpful. They're muscles just like everywhere else in your body. It just happens to be that because they're located internally, because they help with these functions and things that we don't always feel comfortable talking about, we kind of just don't have the same awareness through here. So my lovely little pelvic model here. So this is your pelvis. The abdominal muscles come into me here, hips come in through here, and then low back, sacrum, and then kind of the rest of this that makes up the bowl of your pelvis. So your pelvic floor muscles then sit kind of making up the bottom of this bowl of your pelvis. And so then from there, there's different layers to your pelvic floor muscles. So we have muscles that are located more superficially. And so just for reference, this is your urethra, this is your vaginal opening, and then this is your rectum. So we have these muscles that are more superficial, that help more in sphincter control, so that incontinence piece, and then they also help with sexual function. And then from there, unfortunately on this model, I cannot move my organs out of the way. But for reference, you have your bladder and your uterus that kind of sit in through here. But we have a deeper layer to your pelvic floor muscles, and they are the ones that really help with pelvic stability, supporting our pelvic organs, and then helping with all things with the bladder, bowel, and sexual function. So from here, let's talk a little bit about kind of what's normal, what we kind of expect from day to day around the bladder. Well, in general, with all of our symptoms, we just kind of go to the bathroom when we need to go, and we don't really think too much about it. But when it comes to all of this, these are learned behaviors. We start in diapers. We have to be potty trained to figure out how all of this works. So Even if it is automatic, we can develop habits that unknowingly are contributing to having symptoms. So with that, what we consider normal is to go to the bathroom for urination about every 2 to 4 hours, which is really kind of no more than 7, 8 times in a day. And for a younger person, you should also be able to get through the night without having to wake up and needing to go to the bathroom. When we get a little older, sometimes it can be common to need to go one time, but really in general, you should also not be waking up at night at all to go. And then from there, when you do go, you don't want to feel like you need to push or strain to go. You should feel like you fully emptied after you do go. And, then you should be able to get up off the toilet without leaking and go about your day. And then, say a couple hours later, that urge comes back and then you just go. The way that the pelvic floor muscles function in all of this is they actually are turned on for you all the time. That happens automatically without you having to even think about it, which is the equivalent of holding your arm out all day. As long as these muscles are turned on, your bladder is turned off. So there's kind of this reciprocal relationship through there. And then when we get that urge to go to the bathroom, then we become aware of that. Pelvic floor muscles stay turned on throughout the whole process. And then once we're sitting on the toilet, they relax, bladder turns on, has its own smooth muscle to contract, to empty the bladder. That signals that it's done. Muscles turn back on, and then you go about your business. So if we have something going on through that whole coordination of the system, sometimes that can then impact, and people can start to feel like they leak on their way to the bathroom, they can't quite fully empty, they just went and 5 minutes later they have that urge to go again, or they're just going every 30 minutes. Anything like that can start to creep in. So when we start to look at dysfunction around this whole system, that'll be somebody who either leaks on their way to the bathroom or has leakage doing activities like walking, running, jumping, even laughing, coughing, sneezing. And then it can also be somebody who just goes frequently or even has a really, really strong urge to go. Burning with urination can be a symptom of having something going on with your pelvic floor muscles. Certainly getting that checked out by a medical provider, making sure it's not a UTI. But if you're somebody who's like, I always seem like I have this burning and I get negative UTIs tests, UA tests, then sometimes it can be related to having something going on with your pelvic floor muscles. And so that's all going to be something when you come in for PT, stuff that we would take a look at. I'd kind of run you through all of those questions around, hey, is any of this going on? And then we would kind of start to teach you a little bit again about what's normal, and then some strategies around, if that does apply to you, what you can do to kind of start to get back to not going as often, not leaking, things like that. And then from there, we also want to take a look at what's going on with the pelvic floor muscles. So I'll kind of go into now, if you do decide that any of this is kind of setting off some light bulbs around, hey, that kind of is something I'm experiencing, then it'd be good to come in for an eval. And so when you come in, it is a lot of talking again to see kind of what's going on. And then to truly be able to treat and assess the pelvic floor muscles, it is an internal assessment. It's always with your consent, but I just think it's helpful to know that going in. It's not a pelvic exam, so you're not put up in stirrups. I'm not using a speculum. I want to know more about what's going on with the muscles. What does your strength look like? What is your coordination? Are the muscles tight? Anything like that. And it's not always something we have to do on the first day either, but that is the only way to truly directly treat and assess those muscles. And then from there, you know, we kind of come up with a plan around, is this something that we need to address, and go from there. Some common misconceptions that I would say, the biggest one being that, well, if I leak, my muscles are weak, and so I just need to do a bunch of Kegels. I have folks coming in that were told to do 50 to 100 Kegels a day, and they don't understand why they're not getting better. First and foremost, Kegels are not for everyone. And I would say for a vast majority of my caseload and the folks that I see, it tends to not even be that your muscles are too weak. Oftentimes those muscles are too tight. And so what we need to address first is getting those muscles to be lengthened so that they can actually function better for you. So what we do is kind of similar manual hands-on techniques to getting those muscles in a better place so that then they can actually be strong for you when you need them to be. But then if you are somebody who is on weak or needs coordination, you know, then we kind of work through there. But even if it is doing Kegels, it's not just doing Kegels lying flat on your back, being hooked up to biofeedback. It's more so trying to teach you proper function around when those muscles need to work for you. And then beyond that, I would say the biggest thing too to consider is that you're not just a pelvic floor. So it's taking a look at the whole picture, and especially with pelvic floor PT, it's assessing everything from head to toe. And we want to know, how are you moving? What are your breath mechanics like? What is your posture like? Are you breath holding when you're exercising? And is that creating a lot of increased pressure, causing you to have some leakage when you're jumping? So we really want to take a look at kind of all of your mechanics and how everything is moving to be able to help you get better. And then from there, I just want to talk a little bit about this idea with breath mechanics and breathing. Your pelvic floor muscles are considered one of your core muscles. So you have your pelvic floor muscles at the bottom, your transverse abdominis, which is a deep abdominal muscle, your diaphragm, which is at the base of your rib cage, and then muscles in your back called, kind of as a group, called your multifidus. So we want to have everything in this little canister of your trunk and core functioning and coordinated well. And so with your diaphragm and breath mechanics, when you take an inhale breath, your diaphragm actually flattens and lowers, and that creates this lowering down of your pelvic floor muscles. And then when you exhale, things come back up again. So, you know, coordinating that with exercise is crucial. Biggest example being a squat. And just if you're trying to do a basic squat, you want to inhale when you lower, and actually pelvic floor muscles should lengthen. And then you want to, when you exhale, when you stand back up, so that things can come back up again. And often a big thing that I'll see is that when cued to do a diaphragmatic breath, people want to breathe through their chest instead of using their diaphragm. So to teach as kind of one basic exercise, deep breathing. So I'll just kind of stand so you can take a look at my chest a little more. So when we take an inhale breath, this should actually stay pretty quiet. And when you inhale, you should feel expanding through the belly outward, and then also an expansion through the ribs, where you're kind of breathing through all areas. So with your inhale, things should all expand through here, and then when you exhale, they come back down again. So doing that several times a day can be helpful, because you're teaching your body the coordination that you need, especially when it comes to exercise and how the breath works and how your pelvic floor muscles work. And then that breath strategy you can apply to when you're exercising, even just when you're moving your body. If you are trying to pick up a laundry basket or a little baby, Anything like that, you want to think of blow before you go. So essentially exhaling before you move your body. And so what that's trying to do is help create this canister of support, making sure your pelvic floor muscles and your transverse abdominis are engaged well and that your body is prepped for that movement. So in the specific example of maybe having leakage when you're lifting, caring for your baby, anything like that, sometimes the muscles have just lost their coordination and ability to remember when they're supposed to work for you. So that can be a huge one to just make sure everything is working well for you. The breath can also apply if your muscles are too tight as well. If we incorporate this idea of needing length in your pelvic floor. So if you think of inhaling, letting pelvic floor muscles relax and lower, and then exhaling them come up, that can help to start to encourage this movement. If your muscles are too tight, they're only going to want to do so much. And we, especially with the pelvic floor and the Kegel idea, we really focus on this contracting and tightening scenario, but your muscles have this home where they're turned on a little bit, and then yes, we can contract them and lift them up, but we also need them to be able to relax and lengthen and move through their full range of motion. It would be like only ever doing a bicep curl in this range of motion. So you want to make sure you do the full range of motion. So same idea with your pelvic floor muscles. So doing deep breathing is kind of a safe exercise that if you feel like I want to do something to start helping myself feel better, but I don't quite know what to do, then that is a huge first step and pretty safe for everybody. And pretty much everybody needs to, especially in our current climate, everybody could use some deep breaths. So doing that daily, even a couple minutes a day, can be really, really helpful. Beyond that, if any of that is kind of saying, hey, that, sounds great, and that I feel like I have some of this stuff going on and I'd really, really love to know more. The biggest thing I would say is please come in and get evaluated. With your pelvic floor muscles, it's just so hard to know otherwise what's going on. And as I kind of touched on, the only way to truly directly assess and treat the pelvic floor muscles specifically is to do that internal assessment. So even with doing Kegels, so often I find that folks aren't actually doing that exercise very well. And all they were ever told was just to simply do it without actually being checked to make sure you're doing it well. So if that even is an exercise that would be good for you to do, we want to make sure that you're actually doing it well to help yourself get better. And so really in closing, I hope that this was helpful just to kind of briefly touch on what your pelvic floor muscles can do, some areas around what we consider normal for how often you're going, and general bladder health. And just know that pelvic floor PT exists. You don't have to live with leaking or having pain with intercourse or just not even feeling like you can function optimally. There's things you can do. So the best part about my job is having folks come in and be able to finally get help. It's even what got me into it to begin with, is experiencing some of that myself. So I hope this was helpful, and please reach out if you have any questions.